With most of our efforts focused on COVID-19 over the last 2 years, HIV/AIDS took a back seat as many in the medical field prepared to combat the newest viral pandemic. And despite significant progress in the fight against the deadly disease, HIV certainly has proven to be much harder to eradicate. But perhaps things are about to change with the introduction of a relatively new prophylactic medicine called PrEP, or pre-exposure prophylaxis. On Health Matters today, we take a closer look at PrEP and explore whether it just might be the answer to our almost 50-year battle with HIV/AIDS. The figures are worrying. Almost a quarter of South African women in their reproductive ages are HIV positive. For adults between 15 and 49, an estimated 19.6% of the population is living with the virus. But among all of this, there is some good news. According to a study conducted by SEARCH, a consortium of research institutes, since the introduction of PrEP, the medical field has seen a 74% drop in HIV infections in sub-Saharan Africa.
PrEP is pre-exposure prophylaxis. So what that really means is treatment we give to HIV negative people who wish to continue to remain HIV negative. For now, in our country, we only have the oral PrEP that's available. And that oral PrEP is when we combine two drugs together and we give it to you as one drug, Truvada, which you take once every day for as long as you need it.
At this point, many of us might be thinking, this sounds too good to be true. There must be a downside. And if PrEP is effective or strong enough to prevent something like HIV infection, there must be side effects.
PrEP is absolutely 100% effective in preventing HIV transmission. So if you come into my rooms, the first thing I would do is do a rapid test on you and make sure you're HIV negative. And then I will back that up with a second test where I will do an ELISA. And at the same time, I'll also do a creat to monitor your kidneys. And if I get them both come back to me and they're normal, we will start you on PrEP straight away. There aren't too many side effects to the PrEP. You just need to reassure patients that it's safe and they can happily take it, and they need to be confident in its use as well.
PrEP has swept the globe, with more and more countries seeking out the life-saving medication. But it seems like South Africans are still largely unaware of it.
I just don't think we educate people enough. And I must say that if you come into my practice, I find that the little bit of education you give to patients at the start is the most important thing of everything. Because the minute you enlighten them as to what to do, how to do, when to do it, and why they're doing what they do, they take their health into their own hands. And we, in a funny way, just give patients treatment and no one educates or discusses anything with them. And I think if we changed our views and pushed in education more than as much as we push our ARVs and our medication, we'll see things completely differently.
With everything we've heard about pre-exposure prophylaxis, it does seem like it could be a game changer in the fight against HIV.
Everyone who tests positive needs to be on ARVs, and now we know we're in the test and treat era. So everyone needs to be on ARVs. Within 2 or 3 months, your viral load is undetectable. And if your viral load is undetectable, means you're as good as anyone who's HIV negative. Not only do you have the virus zapped for yourself, but you're not going to transmit that virus to any baby or any partner. And the U equals U is absolutely solid. Undetectable is untransmittable. And this is why in this day and age, we shouldn't be talking about whether you have HIV or not. We should be teaching each other what is your viral load. That is the most important thing. Because if your viral load is undetectable, means you're untransmittable, and U definitely equals U.